Assuming I'm already in the right address, 2 Long Street, Northampton, and 270L. But before I enter the house, I made sure that the environment is safe, no risk for trips and falls. I will close the curtains, windows, and doors to prevent privacy and dignity to my patient. And since my hands are visibly clean, I'll just do a quick hand rub following the 6-step guidelines of WHO. Assuming my hands are dry, so now I'm ready to approach my patient. Hello, good afternoon. My name is Anne. I'll be your district nurse for today. So I am here to give your medication via injection. Is that okay?
Okay.
So for confirmation that I have the right patient with me, could you please state your name and date of birth as I counter-check it with your prescription chart?
I am Emma Hargraves, 26 of the 9, 1963.
Alright, how do you want me to call you?
Just call me Emma.
Okay, Emma, do you have any allergies to food, medication, latex, or others?
None.
Alright, so are you comfortable?
Yes, I am.
Are you in any pain?
No.
No. Alright, Emma, I'm just going to read the prescription chart with you so we can check the medication, okay?
Okay.
So you are Miss Emma Hargraves. Your address is 2 Long Street, Northampton, and 270L. Your date of birth is 26/9/1963, and you don't have allergies. So you are prescribed with hydroxycobalamin 1 mg per 1 ml every 3 months, signed and prescribed by Dr. John Adams. By the way, Emma, do you know what the medication is for?
No.
No. Okay, so hydroxycobalamin is a vitamin B12 supplement for your pernicious anemia. Have you had this medication before?
Yes, I had it
Yes.
before.
When was the last time you had it?
I think it was 3 months ago.
3 months ago. Do you remember where the nurse injected the medication?
It was on my left arm.
On your left arm. So is it alright if I can use your right arm for this medication?
Yes, it will be fine.
Okay, because we need to rotate the injection sites to prevent tissue injury. Okay?
Okay.
Right, so Emma, I'm just going to leave you for a while. I'll just prepare the medication. If you need anything, just give me a shout, okay?
Okay.
So for this procedure, if I'm not familiar with the medication, I can use the BNF, but since I'm already aware what the medication is for, I'm not going to use it. So for this procedure, I need clean tray, which is cleaned with soap and water for the last 24 hours, so I'm happy to use it. I'll be needing syringe. Expiration date is 2020 of December, dry and intact. 2 needles. 1 aspirating needle and 1 administrating needle. Expiration date is 2023-11, dry and intact. For the aspirating needle, 2024-04, dry and intact. I also need 2 alcohol swabs. Both expire on 2021 of October. And I'll be needing a gauze or plaster if my patient wants a plaster. So I'm going to wear my PPE. So when preparing the medication, I need to observe the 3-time check. So first time check is when getting the medication from the cupboard. So hydroxycobalamin 1 mg per 1 ml. Hydroxycobalamin 1 mg per 1 ml. Expiration date is 2021. Now I'm going to open the ampule using alcohol swab, but I need to clean it first using 1 swipe. Then let it dry. So I'm going to open the ampule away from me and away from my patient to prevent injury. Then check for glass fragments. There's none. So for exam purposes, real ampule should be thrown in the sharps bin, but since it's plastic, I'm going to throw it in the domestic bin. Then second time check is before aspirating the medication. So hydroxycobalamin 1 mg per 1 ml. Hydroxycobalamin 1 mg per 1 ml. Expiration date is 2021. No sediments noted. Going to open my syringe. Mindfully not touching the key part. And I'm going to attach the aspirating needle. Then I'm going to aspirate the desired amount. Then expel bubbles and air. Then recap using 1 scoop with me. Sensor, 1 ml.
Yes.
Yes. Then I'm going to change the needle. Using administrating needle, mindfully not touching the key. So now I'm ready to go back to my patient. Hello Emma, I'm back. So for confirmation that I have the right patient with me, could you please state your name and date of birth as I counter check it with your prescription chart?
I'm Emma Hargraves, 26 of the 9, 1963.
Do you have any allergies to food, medication, latex, or others?
None.
Okay, that's noted. So, Emma, I need to observe as well the 5 rights of giving the medication. So, I have the right patient, Emma Hargraves. Right medication, hydroxycobalamin, 1 mg per 1 ml. Right dose. Right date and time today, 1400s. And right route via intramuscular injection. I need to observe as well the 3rd time check with giving the medication. So, 3rd is when, before administrating the medication. So, hydroxycobalamin, 1 mg per 1 ml. Hydroxycobalamin 1 mg per 1 ml, expiration date is 2021. So now Emma, I'm going to assess the injection site. So I can see there's no redness, no swelling, no lesion, so I'm happy to use this injection site. Then I'm going to locate the injection site. So 3 finger press below the crumbing process. And I'm going to draw an imaginary inverted triangle. And then the middle will be my injection site. So I'm going to clean the injection site using alcohol swab using 1 swipe rate. Are you comfortable, Emma?
Yes.
Are you in any pain?
No.
No. Okay, so I'm going to give the medication now. I'm going to hold the needle, the syringe in a dart-like manner, and I'm going to stretch the muscle. I'm going to inject the needle in a 90-degree angle. Sharp scratch, Emma, okay? And then leave 1 centimeter of the needle hanging. And then aspirate. So if there's blood, I'm going to withdraw the needle and start all over again. But since there's no blood, I'm happy to continue. So I'm going to administer the medication for 10 seconds for 1 ml. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and wait for another 10 seconds for tissue absorption. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and withdraw the needle immediately and apply gentle pressure but do not massage. Okay, Emma, we're done with the procedure. Do you want plaster?
No, it's fine.
Okay, so you will feel a little heaviness on this injection site, but it's temporary. But if you experience any shortness of breath, rashes, or itchiness, I will stay with you 30 to 45 minutes to check for untoward reactions, okay?
Okay.
So, I'm just going, if you need anything, just give me a shout, okay? I'll just do my documentation. So, I'm going to sign the medication, the date, today, and the time 1400s. Assuming 30 minutes has passed, so I'm going to... Hello, Emma, are you okay?
Yes, I am.
Yes. So, please remember that if you experience shortness of breath, rashes, or itchiness, and I'm not here, please ring your GP or your district nurses so we can sort it out immediately, okay? And please tell to the district nurse that I've injected it on your right arm so they can rotate the injection sites. And you will receive the medication again after 3 months, okay?
Okay.
So, do you have any more concerns?
No.
So, thank you for your cooperation, Emma.
Thank you.
And Jill. I will do my documentation. So, administered hydroxycobalamin 1 mg per 1 ml. At patient's right arm aseptically, no reactions noted. And then I will do my aftercare. So this will be thrown in the Sharps bin if it's a real ampule, but since it's polyamp, I'm going to throw it in a clinical waste bin.